Hi y'all, my name is Mallory Jones, and the topic I chose to talk about today is vaccines. I'm choosing to talk about childhood immunizations and the legislation regarding these immunizations. First, I'm going to talk about the importance of childhood immunizations. These are so important not only to prevent the deadly disease in a child, but also to limit the exposure of the disease in another individual. Schools have been mandating vaccinations since the 19th century. This is due to children putting things in their mouth and touching other people. They like to cough and sneeze and they don't know how to cover their mouths at this age. This is important because these diseases are highly contagious. The vaccinations cover things or reduce the risk for diseases such as meningitis, mumps, measles, rubella, COVID-19, influenza, and many other diseases. Vaccination decisions and schedules have known to be overwhelming for parents. This is not only due to the fact that parents have to follow schedules and bring their children to appointments to get these vaccinations, but also parents have found this to be a financial burden to them. The Strengthening the Vaccines for Children Program Act of 2021 has helped the financial burden on parents. This is a federally funded program that had bipartisan support. Senator Jack Reed and House of Representative Kim Schreier addressed the efforts to reduce financial and ethical stress on parents and children regarding these vaccines. So, ethical ways that this bill helped was that it allowed Medicaid to expand and provide educational and counseling support regarding these vaccines to parents and children. And also it allowed for any child under the age of 18 that's underinsured or uninsured to receive this vaccine for free. So this not only helped parents that found that vaccinations were a financial burden, but it also allows for parents to be more aware of the risk and benefits for the diseases and why it is so important for children to get these vaccinations before they are going to school, or if they're being homeschooled, why it is so important in getting these to prevent the risk of exposure to other individuals. There are many exemptions that children are allowed to get. There are religious reasons and philosophical reasons that children are able to not get the vaccinations. Some kids do have health problems that prevent them from getting the vaccination, but I found that as a reason that it is so important for individuals who are able to get the vaccination. This is why it's so important for them to receive it. This not only protects them from getting the deadly disease, but it also helps them not to spread it to the children that aren't able to get the vaccination due to an exemption. This is Bill H.R. 722 and S. 2691. This bill overall ensures that mothers and children have proper education, counseling, and access to routinely recommended childhood vaccinations before declining. As a nurse, we are held responsible for properly educating our parents and our children with information regarding these vaccinations. It's our responsibility and our duty to provide patients with the best possible care. And in order to provide them with the best possible care, we should follow through with giving them the proper education to these vaccinations before they are able to just decline them for their child. The policy and issue affect future roles as nurses because patients and parents will be looking to us to get the best information regarding these vaccinations. Oftentimes parents and the children trust the nurses to give them updates regarding these vaccinations and to giving them the proper education of why they should get these immunizations. And I think this is very important. This is a very important topic in today's society due to the fact that COVID-19 right now is so rampant and vaccinations are now allowed for pediatric patients, but some parents are still weary on this because they don't know what's in the vaccination, or they feel it is as if it's understudied and they don't know enough about it to give it to their children at this point. So as a nurse, as I said before, teaching the parents of why it is so important is very important. As we've seen today, the COVID-19 vaccination does not prevent the disease completely, but it does help that to reduce the symptoms when the child may or may not get COVID-19. It helps them to not get as sick, and it could prevent a death in a child potentially. So I found this a very important topic in today's society, and I think that children should be educated, and more bills should be passed potentially to make this as a priority for other children and help parents that are still struggling with that under education and not knowing the risk and benefits for children. And that's really all I have. So thank you so much. Bye-bye.